Hello everyone, I'm going to walk you through Osteosarcoma, a specialized GenAI agent I built on Office's AI. We will explore its technical architecture, core parameters, and see a live execution in action. When osteosarcoma patients receive pathology reports, they are often confronted with overwhelming medical jargon. Terms like Hurl's grade 2, R0 margins, or PDL1 TPS 5%. Off-the-shelf LLMs usually respond with negligency, informal letters that lack medical precision. Osteosarcoma was built specifically to solve this gap, using a multi-branch workflow with strict prompt guardrails. Let's look at the multi-node workflow powering our agent. It all begins at node 1, our if-then-else gate, which verifies that the incoming document structure is valid. Once verified, node 2 over, powered by DeepSeek V4 Pro. This node analyzes the input to extract key rows, background, and instructions. It then dispatches queries across 3 parallel search engines. First, Block 3 runs a live web search for modern oncology guidelines. Next, Block 5 searches our internal training datasets and digital assets. And Block 4 queries our structured clinical database. All 3 streams converge at Block 6, our fusion engine. Block 6 filters out noise using a strict file score threshold of 0.4, while automatically duplicating links like images. Finally, and at Block 7, DeepSeek V4 Pro synthesizes this unfound context, generates a structured report, and exports it directly as a Word document. To ensure high clinical accuracy, we configured several specialized parameters inside processes. First, we assigned the key identity as Osteosarcoma report interpreter. Second, we enforced strict format guardrails with an anti-natter policy. Standard models tend to default to conversation styles like "Dear Patient" or "Sincerely." Our rules strictly require modular markdown and native compression tables in eliminating natter-style wrappers altogether. Third, we programmed domain-specific translation rules. When the system detects 75% necrosis, it automatically maps this to Hurl's grade 2, flagging the patient as a poor responder who needs intensified consolidation therapy. It also pursues critical biomarkers. SATB2 confers on origin, a Ki-67 index of 40% signals high cell proliferation, and positive PDL1 or VEGF markers trigger immediate clinical trial matching for immunotherapy and anti-angiogenic targeted agents. Notice on screen, after just 1 second of processing through our search pipeline, the agent gets straight to work. It confirms the R0 clean margin status. It builds a dedicated Hilbert grading table explaining the extract clinical impact of 75% necrosis. It highlights actionable precision targets recommending PDL1 immune checkpoint trials alongside VEGF targeted multi-kinase inhibitors like RIGO. To sum up, osteosarcoma. Thank you.